I drove home from that session feeling all of a sudden it was the first time I've cried. I mean, I just felt really hopeful, like, wow, maybe this could actually happen on time to help me.
LD 1270, an act regarding patient-directed care at the end of life, failing to pass by only one vote during the recent legislative session. But the narrow loss is giving people like Eva Thompson, who is dealing with terminal cancer herself, a sense of hope.
I don't have any doubt that eventually Maine will adopt this. I think it's a question of when, not whether.
LD 1270 would allow terminally ill patients to choose to end their own lives, but not without many safeguards in place. If it's determined by the doctor that a patient has 6 months or less left to live, the patient may request the lethal medication. After waiting 15 days, they must make a second request. The patient will then have to make a written request and sign it in front of 2 witnesses. The doctor will then determine if the patient is mentally capable. Ultimately, the drug must be administered by the patient himself, and the bill would free the doctor of any criminal or civil liability. But even despite these safeguards, some people are uncomfortable with the idea of allowing someone to end their own life.
Ending another person's life or helping end another person's life is not part of practicing as a physician, for me.
Many opponents of the bill, like Dr. Van Kirk, fear that patients might view this as an only option.
Bringing good care to them, bringing good symptom control to them, almost across the board causes patients to not feel so desperate that they want to end their life early.
Other opponents have religious objections or are concerned that patients would turn to this option as a way of avoiding high medical costs. But some who are facing the end of their lives feel trapped without it.
I can't waste time right now. I don't have time to waste. I have a very short time left to live, and I'd rather be out living it. So I do resent the time that I've had to sit and think, like, what will I do?
Senator Cates says that if he's reelected next November, he plans to reintroduce the bill the very first day of the new session. I'm Ashley Paul reporting for ABC 7 and Fox 22.